As women, we know that our bodies, they're changing all the time. Some of it has to do with age, maybe hormones, or maybe life in general. Dr. Vanessa Dean, she is from Tutera Medical. She is joining us via Zoom this morning to tell us about a procedure that they offer that will improve maybe our intimacy and maybe even our function as well. And it's so good to see you, Dr. Dean. How are you?
I'm good, thank you. Thank you for having me today.
So we're always interested in hearing what you have to offer that can make us feel better and perform better. Tell me about this procedure that you're doing quite a bit there.
Absolutely. So we have a procedure in the office. It's called the Vive Eve procedure. It's being used to help women treat a few different issues that they experience as they age or after having children. The first thing that this procedure treats is actually bladder control. So urinary leakage is incredibly common amongst women, older and younger, but mostly as we age. And then the other two concerns are loss of sensation with intercourse, as well as vaginal laxity and issues with lubrication. So what's amazing is this procedure will handle all of those things in one treatment.
Wow. Okay. So let's talk about the technology that this offers up. We've heard a lot of different options out there. How is this different than anything else?
Absolutely. So there are several things on the market right now helping women with their intimate health, which is fantastic. A lot of those procedures use a laser. And what a laser does is it penetrates pretty superficially and it can burn a patient if not done carefully or for short periods of time. What we're using here with the Vive Eve is actually radio frequency. It's a type of energy that heats up the tissue, but what's nice is we can heat at a deeper level without burning a patient. And we can do a longer, deeper treatment, which yields better results.
Now, does it hurt?
No, that's the amazing part. So the treatment usually lasts about an hour with me in the office, and the most you feel is a little warm, tingling sensation, but no pain whatsoever.
Really? Okay. So who is really the perfect candidate? We talked about, age and having babies and things like that. Is one woman, a better candidate than another for any particular reason?
Well, I think, there's obviously a broad spectrum when it comes to anything medical and, treating patients. I would say the average patient that I see for this treatment has had children. She's aging gracefully, and she is starting to notice changes, usually around menopause. It's also tied in with hormones as well. So our vaginal health is, very much tied into our hormones. So I would say the average age of women I'm seeing is about menopausal range.
Okay. So let's talk about how many times you need to have this procedure. In some other instances, it's often, but spaced apart. How many procedures do you need in order to see results?
That's a great question. So what's really great about this Vive Eve procedure is we're able to do one treatment and hopefully one treatment only. Some women have more severe bladder leakage, and depending on the severity, we've had to go in more than once at times, but the average patient is doing this one time and one time only, and we're hoping to maybe do a touch-up or do the procedure again in a year or a couple of years later. The body will continue to age, so we'll have to touch that up a bit.
Okay, all right. Easy peasy, as they say.
Exactly.
All right. Well, Dr. Vanessa Dean, thank you so much. Really good information. We appreciate you joining us via Zoom. And of course, Tutera Medical always brings a special offer, but here's what you do. You call them, mention Sonoran Living, and they will tell you about their special offer for the procedure. Tutera Medical is located, they have two locations, but Dr. Dean, you'll find her in Chandler, 215 South Dobson Road. That's Building J, Unit 3, 480-874-1515. Learn more at tuteramedical.com.